Welcome back to Startup Health Now, the podcast where we celebrate the entrepreneurs and innovators who are transforming health.
All right, my name is Unity Stoakes, co-founder at StartUp Health, and it is my great honor to be here with Richard Lui, who is an award-winning journalist and filmmaker, and also is really an inspiring leader pushing forward our caregiving moonshot, and we're going to be talking all about that. We are at the health conference in Las Vegas. How are you?
It's good to see you, Unity, and we're sitting in a booth amidst 1,000 booths, and I can feel the energy pouring over the walls.
I can kind of hear the buzz, maybe you can hear it in the background, and it really is a palpable energy. There's thousands of innovators running around, lots of healthcare companies, lots of CEOs. What's your take on the show so far?
You know, I just got here. The energy feels great. I'm looking forward to the next 24 hours to soak it all in. Last time you and I were here was for CES.
Right.
And that was also really great to see the B2C space in the space that we're about to talk about.
Right. Well, let's get into that because the caregiving moonshot, this is a new moonshot that we're working on together at Startup Health. And really, in a lot of ways, I see this as an umbrella moonshot because caregiving and caregivers really touch all aspects of all of our moonshots in one way or another. Let's just start. What inspired you to really focus on this issue? And then we'll talk about why it matters.
First of all, I'm glad you're doing this, and thanks for doing this at Startup Health. I was so excited to hear that you and Steve were saying, we got to do this. This is an important space, the care economy. It started with me when my dad got Alzheimer's 10 years ago. I was working in New York City at 30 Rock, and my dad called me and said I was diagnosed, and early on, right? And so I immediately, in my brain, the gears started turning, and I was like, well, I'm working 8 days a week right now, 25 hours a day, is what we like to say in news, and I knew that couldn't be anymore. So that was the realization that most likely it'd be the end of my journalism career, which I had fought for so long. All caregivers go through that, you know that, Steve knows that, and all of the founders that you have know that, whether it's in the caregiving moonshot or not.
Right.
I know I've heard a lot of the stories and a lot of the interviews and sit-downs you've had, and they're really saying things that are so personal. But there's the other side of that equation, which is the joy, despite the difficulty, that I think powers all of the moonshot community founders in many ways. And that's what happened to me. I took the pill.
Yeah. Well, I'm glad you did because there's such a need.
Yeah.
And this is a huge issue throughout the United States, but it's also a global issue in so many ways. And it's a universal issue in that it just impacts every family, unfortunately, at some point.
I mean, the numbers are gargantuan, and you've seen it across other of your moonshot communities. And there are overlaps, for sure, in all of these spaces. So if you just look at this particular circle in the Venn diagram of what the moonshot communities are at Startup Health, this one says, I'm 10 to $20 trillion globally. That it's saying I am 10 to 20% of all countries' GDPs, 100 trillion total globally. It's also saying I'm 100 million people in America. It's saying I'm 25% to 30% of your population. And that's just one of the circles in the global economy Venn diagram. You could look at brain health, for instance, and say that's also a big circle and a big opportunity. And when you and I spoke 2 years ago, I think?
Yeah, 2 years ago.
You were right in on it and saying, I totally see the horizontal across all the disease paths. And so I think the one thing that I've been talking to you and Steve about recently is how to understand and describe the care economy and the caregiving moonshot. One way is it is your best friend. If you are in Alzheimer's or any of the other moonshots, the second beat is always going to be caregiving in that economy. It may not be the first beat, right? So that's really, and it's really more of a thematic consideration. Can you lead on caregiving if you are a founder? Maybe you need to really lead on 4 or 5 disease paths that are in your back pocket. Then the next step is, you know what? I'm that gargantuan, huge second page or third chapter or second chapter of that journey for that particular sector, that disease path sector.
You're right. Yeah, it seems like in some ways all businesses should be thinking about this at some point in what they're building because it has such a profound, it touches everyone in some ways. Take us into the future. We like to think about these moonshots in long-term frames so that we can solve them in big ways. What do you think we can or should be doing as a world to really solve some of these needs that are out there as it relates to caregivers and caregiving and the care economy?
You know, the first thing I'd say is community. As huggy, squishy as that might sound, as I've done roundtables across the country and as well as on other continents, bringing together business, community, academia, media, and politicos, basically, policymakers. They don't know each other even if they've been in the same town, a small town or a big town, and in this business, this space, in that area of B camp I just described, business, community, academia, media, policy, politics. And that is what is consistent across just about every. So I think in the next 5 to 10 years, as we're going to see connective tissue being built, and that connective tissue, as you know, as you've created ecosystems over the decades with your Moonshot communities, is what many of the members and founders are saying, hey, that's important to me. I didn't think I'd need that necessarily.
Yeah.
So I think that's definitely one thing that will be happening and growing the next 5 to 10 years.
So almost an infrastructure, if you will, that creative community connectivity across that. For example, we have an Alzheimer's moonshot. We have a diabetes moonshot.
That's right.
They all need this theme as a core pillar to what we're trying to solve there.
Inter-community, even within your communities, and in the caregiving community, is that importance, because it's sharing best practices, it's sharing networks, it's understanding where I can't hold up the stool because I'm only on one leg, you can hold up the other corner, and you can hold up the other corner. And I think the second thing related to that connective tissue is the beginning, I hope, of a healthy B2B space in the care economy, which we don't see. So, for instance, if you were looking to understand basically payer codes that would help all of the caregiving founders, well, it'd be great if in the B2B space there was basically a consultancy that say, hey, by the way, Unity, come to us. We'll figure it out for your product service, because I know that's a whole other ball of wax when you think about payer codes, but you need it.
Right, exactly. What's been surprising to you as you started your journey, it touched you personally, and then you've learned so much through the journey. What have you come to learn? What have you come to understand about what the needs are?
Yeah. I didn't think I'd be sitting, saying, and thinking, and actually working with you on this. It was just a burrito of experiences. I love burritos, and I like to stuff them. But it's a burrito of an experience. And I just keep on adding things. I started in the startup space in different technologies, pneumatic and data, and then fintech. And then I moved over to becoming a journalist, and you can see this burrito's getting pretty full.
Yep.
You take the large tortilla.
Yeah.
And then I became a journalist after working at Citibank, and blah, blah, blah. And the journalism really opened my eyes to part of how to express the most difficult stories. And then they kind of came together as I realized, there's a narrative and cultural gap in caregiving that led to two movies, feature movies, on caregiving itself. And by the way, I still say this, who wakes up and says, I want to do 2 caregiving movies?
Right.
Nobody wants to do those. Who's going to watch that?
But this touches people's lives.
Yeah, and that's what drove me. I might be running into a wall, but I was like, I got to run into this wall. That then brought me back around to, okay, if you're closing the cultural gap, the next gap to really fuel a change is business. And we have an economic gap.
Right.
And so you have to have those two really working nicely together. With Bradley Cooper's movie now out, there's a whole series of movies, both narrative and documentary and mixes in between, that are trying to close that cultural gap. When Seth Rogen and Lauren Rogen come out with a HFC, this great movement of you can be young and you can be funny, and this could be still something that is important in society. So I think the cultural gap is starting to close, and that's happening. The economic gap, which you know really well, is where we have to concentrate now more on and work together with the cultural movement.
Is this part education that needs to happen? And one of the things that I think is important that you're doing, and we're trying to do it with the Moonshot here, is inspire more entrepreneurs, innovators, builders to focus on this issue, because first of all, there is a business opportunity to solve something that is really important for people. There's an aging population globally. There's such a need, but there really is a business opportunity, and we need more builders focusing on this. So we're experiencing it and understanding it as family members, as caregivers ourselves, but now we need the builders to step up and see the opportunity.
I think one of the things, yes, and when you meet Unity, you'll see, and you know him through all of the content and media and hosting this podcast. Nice guy, you know, I can totally see why he's the right person to understand our narrative here at, you know, Startup Health. He gets the long narrative, he understands the points we need to hit. But off camera, if you will, when you and I first spoke, I said he really understands this is a hard business.
It is, yeah.
And we can be really good at tough, old school, hard business. You know, I'm meaning like, you know, Rust Belt kind of work stuff.
That's right. Yeah.
We can be Rust Belt entrepreneurs,
yeah,
and still do something that is really great for impact, really great for both the B2C and the B2B spaces. We can really have it all. And, you know, when impact investing started, 20 years ago, we were desperate for models, weren't we?
Yeah, that's right. And if we can go to space, I think the hard problems are the most exciting, and in many times end up attracting the most extraordinary creators, the most extraordinary builders and entrepreneurs. So this really is a call to action to people everywhere. If you want a challenge, come focus here. It's an opportunity, of course, but it's an inspiring opportunity.
Yeah, you've met the entrepreneurs over the years, very successful in their spaces, right? And they've decided to jump out for a moment because of something that happened in their life. And they decided, I'm going to take my success and expertise in this sector or corner, and I'm going to create this model. And I got funders, and I've got the right people. I've got some co-founders that I've worked with in my last 2 or 3 businesses, and we're going to try to solve something in the care space. And then after 2 years, there's no infrastructure to help them make it past the 2 years. The first angel funding, early stage funding, you're 2 to 3 million if you're lucky, and you spent it. And that is why I think, as you're investing in this, and he's not paying me to say this, by the way, but as you're investing in creating a community, the goal really is to get them past the 2 years.
Yeah, that's right. It's such a long journey, but once you break through certain stages, you start to become sustainable. You start to realize, hey, I can do this, and you get to those new levels, and we need more of that. It takes time.
It's not, because it's just not here.
Right.
Like, and this is why the community part is so important.
Yeah.
Like, that is that's one of the major legs of that stool, to get to step up past the 2 years, because the good intentions, the love of the space, the co-founders you may have brought with you, the money that you may have raised, both bootstrapping and, you know, outside funders, goes away.
When we first started Startup Health, there was Y Combinator was around, and this is going back 15 years, Techstars, and they had these wonderful 12-week accelerator programs, which were tremendous, great, especially in the technology world. And when we launched Startup Health around that time, it was a 3-year initial program, precisely for the reason you described, which is it takes longer. Things take longer. You got to get through a year, 2 years. Yeah, you got to go through the journey.
Yeah.
You travel all over the world. You go to a lot of events. You talk to a lot of people. Are you starting to see progress? Are you starting to meet more founders in this area? Are we just at the nascent stage? How would you describe where we really are, and then where we need to go?
When it comes to the care economy, I think that we're at least better off than we were 5 years ago talking about it. When I was in MENA as well as ASEAN and in Northern Europe, I've been asking the question of, how do we size the care economy? Now, based on that answer, I would see two things. One, oh, of course we know the numbers, and these are the subsectors, and this is the way we're looking at investment flows, and that says that in that particular geography, they're at a certain stage, right? Mm-hmm. The other ones would say, what is the care economy? The other potential answer, the third potential answer is, yeah, we would really like to understand the size. And so by asking that very simple question, that is the way I've been able to get a sense of, and why am I doing that? I'm very interested, because I'm a North American, where we're at.
Right.
And we're right amongst all the other continents in terms of we're not like way ahead and we're not way behind. There is the only country, and you've heard the examples before, there's a couple, like UAE and Singapore clearly have started to integrate without being as, it's almost just like, we're going to do it.
They've made it a priority. I was going to ask, are there models to look to yet? And if so, where? You started to get into that.
Yeah.
I think one of the things we also like to do is look to our other moonshots, as well as other startups within those. Hey, are there things we can learn over here that we can bring over there? We're looking for ideas, by the way. We're looking for recommendations.
More.
We're looking for innovators. What do investors need to know, or that you wish the investor world needed to know? Because oftentimes it starts with grants, philanthropy, things like that, but then hopefully it makes its way where investors start to see the opportunity to then start to fund these types of things. Is it just literally as clear as the scope and size of the need?
Yeah, I think for investors, they're going to come in on a disease path, coming in on, and then you have the rarity that understands the care economy. But the important point to make is, for the good outcomes in the disease path sector is going to be the care infrastructure around that. You have better outcomes, you have better ROI, because that product and service will survive and have a higher utility, have a higher traction, higher adoption rates, because you have the right care infrastructure around it. Pharma and their investments in various, for instance, and Phyllis Farrell will be the expert on this, so I borrow and invoke her name, who you know very well.
And she's our Chief Impact Officer for the Alzheimer's Moonshot.
Yeah. That's right. And she will tell you pharma evolved in the last 10 to 15 years in the dementia Alzheimer's space, not only because of the developments that were forthcoming, but because they knew that it was a 360 ecosystem, the way they were going to derive the most value based on the investments they were making in their products, and therefore became services that would surround it. So I think the more holistic opportunity to view an investment is to, you're going to look at the disease path, because there's a product and service that you can directly, most likely at this point, pin the tail on that donkey. But it's tougher to do on the caregiving space. That is the killer app, right?
Right.
So I think that for an investor is to see the broader, better outcomes. It's the way I describe it, it's a lot like, and it goes back a couple days, when eBay first launched, it was doing okay, right?
Yeah.
But how are we going to pay for this stuff?
Right.
And so what did they do? They bought PayPal.
Yeah.
Now, it's the famous business case. When you go to business school and sitting there in class as an MBA or a BBA, that if it weren't for PayPal, eBay would not have been this rising meteoric star at the time. Caregiving is similar to all of the other disease path journeys in the care economy.
That's a great example. It's more of a full stack solution, thinking about the full flywheel, if you will, in business terms of how you really solve something. Really fascinating. Something I've been thinking about is how we expand kind of the opportunity. I think about, for example, a new generation of tools that not just healthcare companies could be focusing on, but consumer companies, retail companies, employers across all business could be focusing on this issue in different ways. I'll just give an example. There's a lot of robotics companies now. There's a lot of exoskeleton companies. And I think about, wow, imagine a consumer-focused set of exoskeletons that help people lift their loved ones out of bed or carry it, out of the bathroom, things like that that you might just think about in a different way. And imagine if you could buy that at Walmart.
Yeah.
And not have to go through the healthcare system
Right.
to have these types of tools and to make it affordable and
Yes.
accessible and all these things.
Those are exciting things. And I know with all of and I'm sure you love your TikTok too, all the videos you get to see that are coming out around what you just discussed are really amazing. How fast are the steps compared to what a real human could do? Is it faster, slower? Is it right, syncopation and blah, blah, blah. And I love all of that. I think that when we are trying to understand the next big thing that will make that happen, and some might argue that robotics will be the intake. I don't know if that's necessarily going to be the intake of what I believe is the big thing. I'm involved in a project at the University of Michigan called Caregiving across the business school, the medical school, and the engineering school. And it's to look at the large-scale primary data set that's out there on the last 3 feet of care.
Wow.
Now, you could argue robotics will be there and they'll be able to gather the last 3 feet of the data on the last 3 feet of care, because that's where we're going to get the payer system to really acknowledge that which is really it. Because if you give it to the analyst and then bring it back up to the decision maker, the analyst will say, I don't have the data to justify that product or service.
Right.
I just don't have it.
Yeah.
But not making a decision, they just said, I don't have the data, and then the decision maker will go, I don't have the data. That code, it's not going to, this service or product doesn't work in that code, or we're not going to create a code for this. And I do believe that if we can put it on the map, basically, that, when Unity sleeps 4 hours, he's able to eat 600 calories versus 400.
Right.
That he can stand up 3.2 seconds faster, that his gait is 10% longer. All of these things that once we can prove that out and show it to products and services within the care economy, and then to in that space, the payers and then the providers can all of a sudden be singing from the same sheet of music. They don't have that same sheet of music.
I love it. You mentioned at the beginning the films that you worked on. Would you talk about those just briefly and where people might be able to find them?
Thanks for bringing them up. So the first one was Sky Blossom, and it was about 5 children taken care of as caregivers, aged 9 to 26, Midwest, South, East, West, Pacific Islands, and they were all caring, and we filmed them for 3 years. We'd come into their house, and whatever they're doing, cheerleading, and it was just really amazing, Unity. And we didn't have the title, and then we did the title at the end, and it was a 5-year project. You can just check it out, skyblossom.com. We called it Sky Blossom, and that's a longer explanation, but I love the story. Diaries of the Next Greatest Generation. I concentrated on the subtitle because after spending time in editing for a year and a half, and I just really got to know who these folks were, I was like, this is the next greatest generation.
That's great.
Those who are caregivers at that age are the ones to... So look for them, hire them, hug them, give them a high five. The second one was Unconditional, about mental health and caregiving. These have military families in them. We just got greenlit for a 3rd movie on caregiving, because you have to have a trilogy, right, Unity?
Yes. 3 keeps coming up.
3
3
keeps,
years, 3 years on your film, and 3rd film. Well, Richard, thank you from the bottom of our hearts at Startup Health, and for all that you're doing to really make this possible and really push this forward. We're so incredibly grateful. You're educating the world, you're helping us, you're helping the ecosystem and community. We're eternally grateful. Thank you.
It's an honor.
All right.
Yeah, good to see you.
Thank you. See you soon.
And finally, an invitation to all of the extraordinary health transformers, whether you are a startup, someone building the future of health, or whether you are an investor, funder, or buyer of the solutions out there in the marketplace. This is an invitation to you to join the Startup Health member community. Learn more at startuphealth.com. Look forward to hopefully seeing you soon.